Health. Smooth 98.1 here. We are, it is 15 minutes going past 5 o'clock, and this is the time where we get to talk health matters here on Smooth Health. I'm Shopper Martins, and joining me, yes, I'm so excited because the first time we had him in the studio here on Smooth Health, it was very eye-opening experience. It was also a hit show as well. So I'm really glad to have Dr. Banji Awosika back in the studio with me. He's a US-based physician with a strong interest in wellness. He's a consultant, a wellness expert, and a nephrologist as well. Good late afternoon, Dr. Awosika. How are you doing?
Fantastic. Thanks for having me on.
So do you know one thing I like?
Tell me.
Is when a person who is an expert in their field demonstrates the benefits of being an expert in their field, and you look rather healthy
Oh, thank you.
and shining and glowing today.
I work at it.
Okay, it shows. It shows. All right. So today's show is going to be an interesting one, right? So we've had Men's Week this month, and also this month has been looking at men's health really here on Smooth Health. And today we're going to talk about something that definitely affects men, and more than half of the men I've learned between the ages of 40 and 70 have had some sort of experience with this. And
Absolutely.
what we're talking about here is erectile dysfunction. And so looking forward to this conversation. And I'm sure we're going to learn a lot. If you would like to ask any questions, share any concerns, or if you have any observations, there's the WhatsApp platform. Use the number, send your messages to this number 0809 440 981. We are streaming live up on youtube.com/ smooth 981 FM Lagos. If you've got any questions, you can also take it to the comment section in there, and I'll be able to read out your questions here on air and have Dr. Awishika see what he can do about talking about them. All right, so let's get into this. So, Dr. Awishika, the first thing I'm going to ask is this: what does erectile dysfunction, or you know what, from here on out, let's use the term ED, mean?
So ED, erectile dysfunction, really refers to the inability to attain an erection or maintain an erection enough to successfully carry out sexual intercourse.
Okay.
That's the best way to define it.
Okay. All right. And I've talked about a little bit about the numbers of men in general between the ages of 40 and 70, but what is the prevalence of it in Nigerian men?
So unfortunately, they don't really have a lot of statistics there, but the research that's out there ranges anywhere from 15 to as high as 60%.
Oh, wow.
Yeah, it's a very common problem, not spoken about
Mm,
for obvious reasons. You know, it's just one of those things men don't want anybody else apart from themselves to know about themselves and of course their
well,
partner,
yes.
right? But it's one of those things that unfortunately should be spoken about because there are things that can be done.
Okay. So, what things that can be done about them?
So it's the most important thing is to first of all have it diagnosed, to
Okay.
have it, to acknowledge the fact that you have it, so you can actually do something about it.
Okay, so that's quite an interesting one because I feel like diagnosis would be pretty easy. You look down and you're like, this is not working. Or are there any other causes that I don't even know how to phrase this question, but I think you know what I mean.
I'll put it to you this way: most men that have any amount, because there are various degrees of erectile dysfunction,
Right.
and anyone that has any degree of it
Mm,
will be in denial of it for quite a while. In
right.
fact, their partners may tell them that they have it, and that will be offensive to them.
Mm,
And they'll go all out to prove that they don't until they realize that they actually do. That could take anywhere from a couple of days to a few years.
really?
Yes, because there are ways you get around it. You get around it and just kind of make things work. But because you haven't diagnosed it, you're not really doing the things you need to do
Mm.
to not just make it work, but make it work the way it's supposed to work. Not just you compare surviving to thriving. You want it to
Right.
be on level of
You
thriving,
want like optimal performance.
optimal perform. You said it so well. So optimal performance for us men, there are very few things that compare to that.
Right. And yet, so yet you don't talk about it. From what I'm getting, a lot of men don't talk about it. I'm guessing there's a stigma attached to it.
There is.
But then, how then do you go ahead to fix what you don't talk about? So, what are some things that some what are some ways to get men to start talking about this?
So, like what we're doing right now, just making people aware of the fact that things can be done. And the most important thing for me, as regards to erectile dysfunction, is the fact that it's almost totally preventable. Most common causes of it, anything that affects blood flowing to the penis, would affect, would can cause erectile dysfunction. Anything. So, various things that you think of that cause decrease in blood flow to the penis will cause it. So it's very, very important to make sure you're doing everything you can
Mm.
to encourage blood flow to the penis. So many medications are a very big culprit. 1 in 3 people on the planet, unfortunately, have high blood pressure. It's a very common problem over the
Right.
age of 30.
Right.
Actually over the age of 40.
And then here in Nigeria as well,
it's
where
actually
we.
more common.
Mm-hmm.
Yeah, they're still touting 1 in 3, but I think it's actually higher than that. It's very,
See,
very common.
everybody has hypertension on their lips.
Exactly.
Oh, yeah.
Literally. And unfortunately, hypertension itself can cause it, but then the medications that treat hypertension are actually more pronounced. They're more of a problem in causing erectile dysfunction. Every
Oh,
single blood pressure pill.
wow. Okay, so now here's the thing, right? So you are taking medication for something else.
Mm.
How then do you guard against the
Complications.
yeah, the complications of it?
And the side effects. Unfortunately, I mean, you're treating a problem with hypertension where your vessels are clamped down. You're trying to get them to dilate. You're trying to get the pressure within them to decrease. That unfortunately decreases the flow through them as well. So on one hand, you're treating that hypertension,
Mm.
but on the other hand, you're decreasing the flow to the penis and everywhere else. So you're at risk for developing erectile dysfunction from the medications for it, as well as the disease itself. But even more common than hypertension is diabetes. Because the best way I describe diabetes is just think of a pipe with water flowing through it. And you put shredded glass in that pipe.
Oh, wow.
Yeah, that's the best way to think
Oh,
of
Dr.
diabetes.
Awosika, I've missed your descriptions. You're back.
Because it eliminates the picture. Everyone talks says diabetes so blasé, just come and talk about diabetes. You have diabetes, do I have that? No. Diabetes is a very major problem. Major, because every blood vessel is affected by it. And the lining of the blood vessel is essentially shredded by sugar acting as
Wow.
glass.
Okay, now, so this is type 1 and type 2, right?
Yes.
Both of them. All the diabetes.
All the diabetes.
Okay.
The only difference between them is what is causing
What
it.
causes them?
On one hand, you have a more common one, which is just because of insulin resistance.
Mm.
You've developed a lifestyle that has led you to have your body resistant to insulin. The best way to describe it is you think of putting a key in a keyhole and there's fat, there's gunk in that keyhole. You can't open that door.
Okay.
So that's what happens when your body's resistant to the insulin. Insulin is knocking on the door, trying to put the key in, but it can't fit in because the body's now resistant to it. Usually from fat. Most common.
Right.
And that's the big thing. Now talking about erectile dysfunction, the same things you do to reverse the diseases that cause it are the same things that will actually cause your erectile dysfunction to get better. So eating better, because you're looking to reverse high blood pressure.
Right.
You're looking to reverse diabetes. You're looking to reverse high cholesterol. I call them the big three. The
Okay.
big three. The more you have those out of those big three, the higher the chance you have of having stuff clog your blood flow. Your blood flowing to the various organs, so blood flow being clogged going to the heart attacks. Being clogged going to the brain, strokes. Being clogged going to the penis, erectile dysfunction.
Right.
Clog going down to the legs, arterial disease. So blood flow is key. It's all in the blood. So you have to make sure that traffic is clear. No
Wow.
trailers on the road, just
Mm.
Ferraris, just zipping,
Oh
zipping through.
no. All I remember from Ferraris is meat. Yeah, I know you're gonna bring meat into this conversation. People, are we ready? Okay, but quick question. So you talked about I want to know actually what are the common underlying causes of erectile dysfunction. You talked about the big three. Are there any other common ones?
Actually, so unfortunately, very commonly is it's in the head. It's a
Right.
mental thing where you're either going through severe stress, severe anxiety. Anxiety is a big one,
Mm.
especially for men doing this for the first time or a new wife or various reasons why anxiety becomes a big deal. And apart from the things mentally that would affect it, I mentioned medications. There's the psychological effects of various things, various other diseases. There are various systemic diseases, cancers, that would actually affect that part of it. So there are various things, apart from medications and the common diabetes, hypertension,
Mm.
that would affect blood flow to the penis. So it's all about getting optimal flowing of blood to the penis.
I really love the fact that you brought in the mental aspect because, that would be the question: is it just a physical thing? But then you now say that okay, there is a mental aspect
Absolutely.
that can affect that, and now it goes on to treatment. How would you treat something like that
Exactly. So
when the problem resides in the
in
mind?
the mind, as well as because it's usually almost always a combination of it. So even if you have the
Mm.
physical will not make you anxious, especially when you have a history. So your history shows that the last time you tried, it wasn't successful, your partner wasn't happy. All these things affect you mentally, especially us as
Mm.
men. We don't want that played with. We want to show that we have it. We perform. When we're told we can't perform, the anxiety that evokes going into the next time is severe.
The men will now not say will now come and be fighting you when you say very sensitive and delicate.
Yes, yes. It's almost one of those taboo phrases. Do you have ED there, darling? Do you think you have ED? No man wants to hear that, except they're watching a movie, not about themselves.
Wow, that's
It's a big deal.
real taboo. So when we were talking about the big three, right, and you talked about diabetes, I just found out that there's this country, a Micronesian island. I can't remember what its name is. Starts with an N. Anyway, this Micronesian island, where 94.5% of the inhabitants have diabetes.
Mm.
And I'm just thinking, okay, so basically for the men there, that's like ED, ED, ED.
Yes,
Ooh,
yes.
wow.
You think of diabetes and you think the most common cause of blindness on the planet is diabetes. And of course, blindness is something that nobody wants to
I
have.
did not know that.
Oh, yes.
And
It's
now
a
I do.
big deal. So, because remember, think of that description really catches it. When you think of shredded glass going through a pipe, flowing down, just shredding the lining, everything that the vessel supplies is at risk for not getting blood flow.
Wow.
And where there's no blood, there's no life. Things die when blood don't get to it.
Let me go to your messages because this shredded glass imagery, boy. This one in from Yemi from London says to Dr. Awosika, what is the best effect to cure erectile dysfunction? Oh, I feel like this is a long answer. We might take a break before we get to that answer. Let me take Cruz's messages before we take our break. Cruz says, "Oh my goodness, wahala deal. That statistics, Dr. Wishika told us that is heavy." He goes on to say, "Now we know why Okbang is plenty on the streets." And yes, Cruz, the session is alive right now up on youtube.com/smooth981 FM Lagos. You can go and you can catch the replay on YouTube, but make sure you keep it tuned here and keep your messages coming so that we can answer them in real time. All right, we'll take a quick break now and then we'll be back with more here on the Smooth Health.
Health on the Drive.
Nice.
Really
All right,
nice.
YouTube, I will go over to you and see if we have any questions here. Oh wait, no. YouTube is better from here. No, not sure. All right, YouTube, do remember that you can, YouTube viewers, do remember you can send your messages in on where it says say something, and we'll be able to get your comments out there. Okay, we are back. Okay, and we're back for the second half of our conversation with Dr. Banji Awosika, who's a wellness expert and nephrologist, talking about erectile dysfunction here on the Smooth Health. And we've got messages coming in. So back to Yemi's message, which, Yemi, that is a question that has an answer that deserves time and space. So, Dr. Awosika, just to recap for anyone who's just joined Smooth Health, the message in from Yemi from London says, what's the best effect to cure erectile dysfunction? Over to you, Dr. Awosika.
So the best effects, I'm assuming they mean the best way to cure it. It's more along the lines of, first of all, prevention is what I want to really focus on. And the same thing that you do for prevention, you have to do to as part of your regimen to cure it, which is everything you should be doing lifestyle-wise, what you're eating. Going back to, of course, the animals, anything that causes inflammation. Inflammation within the system is caused mostly by the fat from animals.
The animals.
Animals being everything that had a mother and father at some point. So yes, fish. Everyone asks me about fish, and I say fish 3 times. That is definitely part of the animal kingdom.
Not even the salmon that do all that work and swim upstream.
A mother and father at some point, so it's an animal.
It grew muscles. Muscles are good for you.
Oh, of course, but those muscles that have fat within them, they're an issue. So it's not about the fat that you see. It's actually fat droplets that you don't, because the inciting inflammation is the issue. That's why people talk about the amount of amount of animals you should take in. I say no, it doesn't matter. You can eat the whole cow, because if you take a little piece of meat, you take the whole cow, they're causing the same inflammation of the system. And if it happens chronically, you get things like erectile dysfunction, you get things like heart attacks, cancers, strokes. Everything happens from inflammation. The most important stimulus is fat. The most common vehicle for fat into our system is animals. So as much as I love animals, I tell my patients, take it once a week. If you're on medications, once a week. If you have erectile dysfunction, once a week, for sure.
I've tried to go according to your advice with varying degrees of success. From our last Smooth Health, you've really made me try and be healthier.
Fantastic. I'm glad to hear.
Work in progress, people. But anyway, continuing on with so what else apart from food intake?
Right. So food intake, and one thing I say about trying, don't try and do, just do it. I just wanted to interject that one because you've been trying. You stop trying. So just do it. Okay. So so food. So we mentioned animals. Now the things that mitigate against inflammation will be your fruits, your vegetables, your legumes.
Any kind of fruits, because people have talked about sugary fruits like your citruses, your pineapples, and very ripe bananas.
So any kind of fruit. As long as the fruit is not sitting down behind the piece of meat or chicken in the gut. Because if it's sitting down behind that trailer, it can't zip by. And then the gut just squeezes on that little piece of fruit and sucks every little ounce of sugar out of it. It goes into about spikes of sugar.
Ooh.
So the whole idea is to have to create a freeway that it just zips through and out. You get all the benefits of it, but not the negatives.
So, like people have talked about, the Daniel fast where they eat, fruits and
Pulses,
veg and pulses and whatnot, and kind of in their as much unprocessed form as possible. This is basically the diets that you're telling people to go on.
Not quite.
No?
Because I find it hard. I did it for a couple of years. I was totally vegetarian. But I realized that you get the benefits of being a vegetarian if you minimize the animal protein intake. So as opposed to taking none, if you have I call it an anchor day, where you have your animal, you enjoy it, and you spend the next 6 days looking forward to that anchor day again.
So, okay, just to confirm, you can do like your 6 days of good fruity, veggie, pulses, legumes, everything. And then if you wanted to eat a whole cow on day 7, eat the cow.
Eat the cow.
Okay.
But, caveat, remember how you feel the next day after your cheat day. So let that guide your next cheat day. Because you're allowed to eat the whole cow, but there are other things that happen when you eat a whole cow.
Okay.
So remember how you felt.
Okay. All right. What else can help with erectile dysfunction?
So without, as opposed to nutrition, you have to talk about hydration. You have to hydrate. Very important. Hydration is one of those things people don't think about, but it's a very, very big part of getting blood flowing to where it should be flowing to.
See, I'm so I love this. So your 1 ounce per
KG.
per kg. Yeah, your 1 ounce per kg. I've been telling everybody that
Fantastic.
now because I calculated it and I've been trying to make sure I drink that kind of water. Before I was
Excellent.
just drinking 2.5
Randomly,
liters. I
right?
need to drink more. And one thing that I tell people, a lot of people will tell me, oh, they have headaches. And the first thing I ask them is, have you drank any water today?
That's
And the
fantastic.
answer is usually no, I haven't.
Well done.
Hmm.
Very well done. You've been an
Water
ambassador for
warrior.
this message. No, it's a very big deal because most people don't know. And 95% of the country is dehydrated. They just don't know it.
Mm.
Absolutely. By the time you wait until you're thirsty, you're already dehydrated.
Oh.
Because unfortunately, we suppress our thirst mechanism. We don't respond to it quickly.
Yeah, because actually, something that was such an interesting one for me was, oh, when a lot of times when you're hungry, you're actually thirsty. Mm.
Very good. So drink water first.
Mm.
Now, the downside of that is if you drink too much water and then you eat, you're diluting your enzymes in the gut,
Ah.
which can affect your digesting food. So you have to moderate that. But then you should get some water in first and then check to see if you're actually hungry then. Because many times you're not. You can stave off food for a while or stave off eating nonsense for a while until you're actually hungry. Maybe by then you've gotten some discipline in to eat what you should eat.
We pray, we hope.
Amen. Amen.
Yes, yes,
Hallelujah.
yes. Okay, so food, hydration, anything else?
So food, hydration, rest.
Rest.
Rest is one of those things that we don't think, especially as men. You know, we're constantly hustling, trying to provide, and we hustle.
Especially in a place like Nigeria where the
Yes.
onus is on men to be the provider and breadwinner.
And you know, talking about time, you don't have enough time in the day. If you're spending 4 hours traveling to work, it's a little hard. But then I always say in those 4 hours, why aren't you sleeping? Because if you're driving, then you can't sleep. But if
Yeah.
you're being driven, that should be time to sleep. We're not sleeping enough. We're not resting enough. With erectile dysfunction and anything that pertains to decreased flow of blood, rest is key. Because you have to teach those vessels how to secrete what they need to secrete to get the blood flowing. There are various chemicals that come from the lining of the vessels. And a healthy lining of the vessels will secrete these chemicals that would help in getting blood flowing to the penis. It's very, very important to get nutrition, hydration, rest, exercise. Exercise.
Key.
Key. Because you have to get the blood being pumped from the heart to the various parts of the body on a constant basis. Constant. Just more vigorous pumping. More pumping, more blood flow. And that comes from exercise. But exercise does many other things. It releases chemicals that you need to get the blood flowing. Very important. I can't stress it enough.
So you would say the first thing anyone should do is lifestyle change.
Absolutely.
Now, if let's say they've undergone a few months where they've started walking, started getting the blood flowing, have raised their face and their eyes away from meat, and at least for 6 days, and they've been on track, and yet things are still not working, what would you say then?
Then you can try the medication. There's certain medications that work. They're called phosphodiesterase 5 inhibitors, and they would work to help get blood flowing to the penis. They're used for other things, especially with lung disease, lung hypertension in the lung vessels. But we use them very successfully for treatment of erectile dysfunction. One of them is sildenafil, the other one is tadalafil. Those are the two main ones that are out now that are being used, and with varying degrees of success. Some people swear by them, some people don't. Unfortunately, you get a headache sometimes as a side effect, and sometimes it just plain doesn't work. But when it does, it's fantastic. Now, other than that, there are other things that can be used. There are certain injections that can be given that would help. There's certain
Direct to source? Oh,
yes, direct to source. It doesn't sound very pleasant, but it's actually not as bad as it sounds. And then there are certain more mechanical devices that you use to essentially pump yourself up.
Okay.
So you get a button, pump yourself up, and you get your erection. So there's help out there. There are things that can be done, but no matter what you do, that's for definitive cure or taking care of the problem definitively, wellness and what you're doing lifestyle-wise should be the first thing done. And really, erectile dysfunction is a marker of worse things to come.
Oh, wow, really?
Yes, absolutely. Because it's a sign of poor blood flow to the penis.
Right, and if there's poor blood flow to the penis, there's poor blood flow everywhere.
Else. Exactly.
Oh.
So sometimes that may be how it manifests, and that might be your harbinger of a heart attack.
Oh.
So it's just one of those big deals that
Oh.
people need to pay attention to and take their lifestyle to treat everything else coming down the pike.
Please hear this, because that's like your gateway um issue, illness. I don't know what to call it now. Gateway issue
Yeah.
to bigger things. So please, if you've got it, even if you don't want to talk with your loved ones about it, you can secretly go to your doctor
Yes.
and sit down and have a chat, because this could be a sign of worse things to come. Don't wait for the worst things to come. We can't afford it right now.
Absolutely.
Mm.
And unfortunately, many times the physicians don't speak about it unless
Mm.
you talk about it to the physician. So when we're just getting all our screening questions asked for a new patient or patient that's following up just for a checkup, it's not a question that's commonly asked, unfortunately. And it should be asked. I encourage my colleagues to ask that question,
Okay.
but I encourage every male patient to ask about that. Because I think that can
Fantastic.
be done.
Okay, please do, please do. Now, this message in from Mayowa from Ikeja says insightful stuff. Shredded glass going through a pipe. My goodness. And now Mayowa says, how do you cure ED caused by mental stress? Would it still be lifestyle, or would it be something else?
It'll still be lifestyle. So remember, the mental stress improves with nutrition. Mental stress improves with hydration. It definitely improves the rest, improves with exercise. And one thing we didn't mention was mindfulness. How you're actually thinking about the problems you have. Because that's how you manage stress.
Mm.
If people talk about avoiding stress, you can't avoid stress unless you're dead. If you're alive and living and hustling, there will always be stress.
Mm.
So you learn to manage it better. You manage it better. And when you see signs that you're stressed, erectile dysfunction is usually a sign that there's a stress factor, the stressor in your environment, either in your body, in your environment. You have to recognize that and
Yeah.
get out of it. It
And
could be relationship, it could be so many other things.
I had Dr. Anu Martins in on an episode of Smooth Drive, and she talked about dealing with stress in some ways. I think there were four A's, but the only two I can remember are like alter and adapt. And part of that is like, okay, so you need to, the situation won't disappear, so you need to adapt to
Absolutely.
it, and then you need to alter your thinking around it as
Absolutely.
well, because it really is a mindset and
It is a
mind
mindset.
shift thing.
Absolutely.
Mm.
Absolutely. And with mindset, you have to figure out whether you have a growth mindset or a fixed mindset. With a fixed mindset, you believe you've already become. With a growth mindset, you're constantly becoming.
Oh, I like that.
Yeah.
I
So
like
so
that.
once you're able to shift from a fixed mindset, which I used to have for a long time, I didn't realize that I was defined by my failures and by my accomplishments. If I was failing, I'm useless. If I was succeeding, I'm it. You're not supposed to be like that. You're supposed to be failing and then encouraged to now succeed, knowing you can, or succeeding and encouraged to succeed more. So it's a
Mm.
growth mindset that we need, and that helps with ED. It's very, very important actually, because you're looking to get creative with what can I do to fix this problem. I got to speak for myself now. I had um, cancer of the prostate,
Oh wow.
and I had surgery about 10 weeks ago. And one of the most common complications of cancer of the prostate is erectile dysfunction and also incontinence. So I dealt with this myself for a time. And it was very interesting because I found myself getting creative as to what can I do. And that's why this discussion, this topic, has become so important for me because I know what I went through and I have the knowledge of it. If I went through that with the mental anguish I had, I can only imagine what people are going through out there who don't know what I apparently do. So I'm just so glad to be able to share this.
I'm so glad that you came in and that you are here to share it, and I'm glad that you're here, in good health,
Thank God.
getting better every day,
God is really good.
all
Total
the time,
gratitude.
all the time.
Total gratitude.
Okay, messages from Sinfadra. I think we might take a little extra time and go through some of these messages. Maybe. So this one in from Sinfadra says, Dr. Awosika, what's your take on taking all sorts of drinks to remain active? A lot of people don't know that erectile dysfunction has to do with blood circulation. Some take herbs and mix a lot of things to remain rigid. And then he also says some women become very aggressive when they see their man isn't very active. They feel the young man might have had a shot outside, which is why he isn't active at home. Okay, Savadra. That's an interesting
That's a
one.
good one. That's a good one.
Okay. But what's your take on mixing of herbs? I'm guessing not great.
So the question is, what herbs are we mixing? What are the chemicals that herbs create? What are we? The body is a big pool of chemicals. There are lots of chemicals reacting in different ways to effect different functions that we need to carry out to live. So when you have chemicals being introduced to either increase a particular chemical that does a particular thing, the question now becomes what else is it doing? When we're causing the chemicals to go up higher than they should in the blood, what are the side effects of that? So when I hear herbs, I always question what herbs? What are they doing? Okay, what else are they doing? If you don't know that, then that's a problem.
I'm pretty sure they wouldn't.
You know, if you're getting an erection with these herbs and nothing else is happening, that may be okay. But then what happens in 5 years? You develop a cancer, you don't know why you got it, or you develop an autoimmune disease where your antibodies attack you don't know why you got it. So I would say minimize the chemical alterations in the blood, minimize the chemicals being added to the blood, and when they're being added for a definitive reason, let them be added for a finite amount of time, so that you're changing, you're reversing your activities, your lifestyle, so that you're able to get rid of that chemical being introduced, that medication, which is a non-chemical.
All right, so I'll take this last question from YouTube from Wale Cams, who says, does this have any connotations to sleeping off at the wheel, perchance?
Yes, yes. So it's interesting. If you're not resting, you will sleep. Your body is pretty intelligent. We in our infinite wisdom, we feel our brains are more intelligent than our body. We tell our body what we need our body to do. You know, I need you to function on 4 hours of sleep. The body looks at you and your big brain and tells you that, yeah, no, not going to happen. I'm closing down now. You better be near a bed because I'm about to close down. And you can continue ignoring it until it does close down. Possibly while you're driving, possibly while you're operating in the theater. We have to get rest in. It's key. 1/3 of your life should be in bed.
People, did you hear that? So anybody who talks to me about sleeping too much, I am going to direct you to Dr. Awosika. And we've come to the end of the conversation here on Smooth Health. Thank you so much for all your messages and your questions and your insightful comments. And Dr. Banji Awosika, thank you so much. He is a US-based physician. However, when he's here in Nigeria, he works with Iwosan Lagoon hospitals to help build capacity through knowledge sharing, hands-on procedural training, and a reverse medical tourism. Ooh, I like that. Reverse medical tourism. And so you know where to find him. And also, I think a lot of people would want to find you. Are you on social media? Are you anywhere
Yes.
that we can? Okay.
Yes. So I am on the Instagram. Instagram is Dr.Banji. Twitter. What's the Twitter handle? That's I think that's Dr.Banji as well.
I'm going to find you right now. Can't even wait for the show to end.
Our website, Dr. Awosika, at westorangenephrology.com.
Okay, Dr. Banji, I have found you. All right. Thank you so much, Dr. Awishika, for joining me on Smooth Health. It's been a real eye-opening one. As usual, look forward to having you on more of this show, more episodes of this show. Okay, and to all of you, thank you. And make sure you catch the replay, youtube.com/smooth981FM Lagos. All right, and we are done with Smooth Health. Thank you so much for watching.